All right. So I will hand it over now to Sara just for a quick introduction, and so she can start her presentation.
Sure. Hi, I'm Sara Valli, and I am the director of ATinNH's, and which stands for Assistive Technology in New Hampshire. And we are part of the Institute of Disability at the University of New Hampshire. We are an Assistive Technology Act program, and let me see if I can read my slides. And so we are one of 54 different Assistive Technology Act programs. There's one in each state and also in United States territories. And we are charged with providing assistive technology to people from birth to death across the state. And so the ways that we do that are we provide demonstrations, trainings. We also provide loans, which I'm going to talk about. And we have a new program where we are doing fabrication a little bit differently than it had been done in the past. And I will talk about that with our Maker Ability Hub. And we also provide a discount purchasing program. And I think I said trainings as well. So those are the different things that every AT Act program provides to the state that they are housed in. So some of the things that we do provide for people in the state are tools that you can borrow. And I will walk you through how to borrow things from our AT for All website. I really want to make sure I share that. You Anyone in New Hampshire who either has a disability or is a caretaker or a family member of a person with a disability or a service provider or an educator can borrow our pieces of technology at no cost. And I say no cost, there are a few things that do have a small fee for them. Primarily, those are the bigger recreational items that are housed at Northeast Passage. But we have a whole variety of different types of assistive technology, things to support feeding, bathing, dressing, all kinds of different personal care and general household tasks. I will talk a little bit later about some of our kits. So, for example, we have an adapted cooking kit that has a variety of different tools that supports people who have different disabilities and being able to cook meals. We also have programs that have durable medical equipment, things like walkers, wheelchairs, power wheelchairs, things like that. The loan program doesn't have the powered things, but we have a partnership with the Refurbished Equipment Marketplace in Concord, and they provide refurbished electrical devices as well as walkers, wheelchairs, and whatnot that you can buy at a drastically discounted price. We also have assistive technology needs for our tools for education, things that support reading, writing, executive functioning, sensory needs, all kinds of different things that can support students both in K through 12, birth to 3, and also college students or continuing ed students. And then we also have some AT devices that help people be able to participate in day services or social and health groups. We have some apps and iPads you can borrow. And we have the ability, if someone had a respite worker, they are also welcome to borrow things. And that might come into play if there was someone who had a communication device and someone who is working with that person wanted to learn to use that device. They could borrow an iPad from us that has apps on it so that they could kind of learn how to use it and play with it a little bit. So those are just sort of some of the things. So assistive technology uh, can help to limit the barriers or reduce the barriers related to disability in mobility and communication, in vision, hearing, cognitive and learning challenges, and muscle coordination and fine motor skills. So those are just some of the areas that people might experience barriers to independence and tools that we may have. I'm just going to talk a little bit about the different levels and give some examples. Assistive technology is really any tool. It can be something that was purchased, fabricated, or adapted that helps to make it so that someone can complete a task that was otherwise limited by their disability. And there are levels. There's low tech, which are non-electronic devices, mid-tech tools, which have basic electronics, audiobooks, some basic communication boards, and then there's high-tech tools. Those are more computer-based systems, or things like virtual reality, AI, things like that. Um, so I'm going to start at the top and give you some examples of some of the high-tech things, and then work my way down to the lower tech things. So there's a lot of different tools that um, that allow people to have smart home technology that helps support independence, whether that's that someone needs a little support to be home alone, or someone has some mobility issues or vision or hearing issues, that you can use all kinds of different smart home things, and smart medication dispensers that will only allow a certain amount of meds out of them at a certain time. There's things like health monitoring devices that can help support people who might have things like low blood pressure or heart deficits, that can kind of monitor and give an alert to a care provider, blood sugar. I mean, those kinds of things. There's also a whole lot of different uses for indoor security cameras and outdoor security cameras, all kinds of different things. And so we can run specific trainings on how to do some of those things. I want to share, these are some options. You all will get this slideshow after, and these links are live that you can use. So these are some of the kind of high tech things that might be helpful for people. So Morphic is a really fantastic free app. Well, it's not really an app, it's a widget that you can download on a computer, and it pulls all of the accessibility features to the front of the computer. So if someone needs something read aloud, or they need things magnified, or any of those kinds of things, it pulls all of those tools to the front so that there's a little toolbar on the bottom. Because oftentimes there's things that are built into Microsoft or Apple, and finding them can be a little bit difficult to make that ease of use happen. Also, it allows you to create some buttons on the side of the screen that go to certain places. So it can limit someone's ability to go in and access everything in a computer. So it may be that you have someone who you really only want to let them access a kid's YouTube channel or something. You can put a button just to that. Or you would like them to be able to join a family Zoom meeting that happens once a week, or a therapy appointment that happens online once a week. You can put that in as a button on the side of the screen, and they click on it and it just goes to that place. Other kind of higher tech things are, there's a fantastic app called Be My Eyes. We have a video coming out on independent living, and this is one of the tools that one of our people used in the video. And this is a really cool app because it's live volunteers. So if you are someone who either struggles with, it's really created for people who struggle with vision, or it could be used by someone who struggles with reading as well. And there's something along the lines of an Instapot, and someone is not sure which buttons to press. You call and you hold the screen up, and it's like FaceTiming with someone who will walk you through how to use that appliance or that tool. So that can be really helpful for someone who might need a little bit of help. And And it could be used for, say, I want to put something in the microwave for this long, and you can use the app to show the directions and have the person then help you press the buttons on the microwave. So there's also home care monitoring systems. There's a site called Vantiva, and that kind of helps families stay connected with someone's home care, medical needs, things like that. Um, and then there is this really cool little kind of robot tool that we have on its way to our lending library. And I'm not exactly sure how we're going to be able to lend it out. It may be more of a demo tool, but it's an AI kind of sidekick that you can set up to help. And it can be used, they designed it for aging, but it can also be used for all different age people that will give you reminders and ask you to play games and kind of help keep people engaged. You can also set it to alert a family member if something goes wrong in the house, and it's a pretty neat little tool. Um, and then this is just sort of, I wanted to share this because smart home systems are really fascinating in that you can set up so many things for voice control. I was recently in someone's home who is in a wheelchair, and rather than installing a whole big button system to open their door and close their door so they could get in and out, they have a voice controlled door controller. So literally they say, they can see on their Ring camera who's at the door, and then they can say, computer, open the front door. And then or if they want to just go outside, they can say, computer, open the front door. It'll open it. And then when they get outside, they can say, close and lock the front door. So there's some pretty neat ways that you can use your voice. There's also like smart plugs, so you can plug them into lights. So if you get into bed, you forgot to turn your light out, you can just say to your phone, turn off the bedroom light. And so there's some pretty neat ways that allow people who maybe have mobility needs to have all kinds of cool tools in their houses. Um, I I would be remiss if I didn't spend a moment talking about virtual reality. And many of you have probably seen the VR sets that you can put on your head. Um, and at the moment, I do not have these in our lending library. I am working on it, but there is some significant research around virtual reality and supporting people who are struggling with mental health, depression, loneliness. And some of that research has to do with how your visual and experience of nature specifically can improve your body's ability to heal and to feel joy. Specifically, I was just reading about a study where there was folks on a floor who had all had the same surgery. They had all had gallbladder surgery, and one side of the floor, everyone's windows looked out to a brick wall, and the other side of the floor, everyone's windows looked out into trees and nature. And the people who could see the trees and nature, on average, went home at least a day earlier than the people who could not. And that speaks to the way that your body processes and takes in the visuals around you. And so being able to use something like virtual reality to help combat loneliness, depression, those kinds of things. There's also some really cool ways that it's being used for physical therapy and occupational therapy and cognitive tools that are really just very promising. So those are like the high tech things, and communication devices. So communication devices can be used really there's a lot of research that shows that if kiddos are struggling with articulation, with something like apraxia, that it's really never too early to start teaching them and have them use a communication device to build their language skills. And then it also can be used if you are a person who knows going to lose your capacity to communicate, or someone who maybe has had a stroke or has seizures that may be impacting communication. And we have a bank of about 30 iPads that people can borrow for up to 45 days. And you can request a few different apps. In fact, we encourage people to request a few different apps so you can see which ones may work. You probably should have a speech and language pathologist involved in that process. But if you've got a speech pathologist who is involved and your kiddo or someone that you're supporting needs an AAC device, you can also borrow one so that you can mirror and model with them. So they can have their own and you can borrow one and really get comfortable with the system. And so that's a neat service that we have. Mid-tech supports. So there's all kinds of things. These are things that might use a little bit of electricity, but or work within a computer. There's apps, there's battery operated magnifiers, things like CCTVs. There we have FM systems where you can put them on your head and it will amplify someone who's wearing a microphone's voice. We have a whole bunch of those that people can borrow. There's software, things like dictation software, note-taking AI software, all kinds of different things. So there's a lot of different options for mid-tech supports. And I think I did mention Northeast Passage is one of our partners, and they do charge a small fee for some of their things, but they have a variety of different electric bikes. They also have things like beach wheelchairs, and they have all-terrain wheelchairs that can actually go into the water as well, so that if somebody who was in a wheelchair wanted to go on a hiking adventure or the school was going on some kind of a field trip that involved biking or hiking, there are options. These are just some more examples of mid-tech. So sometimes people will not be as engaged in things like helping with cooking or with being able to use phones or all of those kinds of things. But we have a lot of tools that can make all of those kinds of things much easier. So we've got, I think I mentioned it earlier, and I'll show you how to access our lending library in a little bit, but we have an adapted cooking kit, and it has things like an electric jar opener, because there are a lot of different types of jar openers, and the handheld ones are in there as well. But sometimes someone just needs to be able to put something on the lid of something and press a button and have it open. And that can be the difference between someone being able to participate in deciding what they want to eat or helping with a meal prep and not being able to do that. And then there's also little mini electric can openers. There's so many different neat tools. And this up here on the right is the example of the Pocket Talker. It's the little FM system that we have. Okay, so then there's low tech things that we have. And these are non-powered things. And we have so many different options. We have, I'm going to shift to the next slide so I can show you some of these. But so we have, there's things like maybe a silicone feeding mat that you can just put on the table. We have adapted cutting boards where you can either spike the food onto the cutting board so you can cut one-handed, or use that kind of clamp thing that's built in. We also have, I think, 8 or 9 different types of knives with different grips so that people can try out how their body's motor planning and their ability to bend and move their arms might work for cooking. We also have, we actually have keyboards that have bright and bigger colors, but there's also keyboard stickers. There's different kinds of can openers and cups. And then over on the right, there's a picture here of the Halo tactile icon stickers. And this set is made for a microwave, but these are really great if you are teaching someone how to use a microwave who may not be able to read times or set things, press all the different buttons. You can put these little icons on the buttons that they would need to press to cook the things that they most often would use. And there's a variety of different ones. I just really like those. And there's just a low-tech sticker. And they also make those for remote controls and other small things. And then there's also these adapted handles and universal cuff things that can fit on any different kind of tool. In fact, fascinatingly, I heard Walmart had these in their back to school sale stuff this year, pretty affordably. So these are some other things if you're caring for someone who is aging. Or who may need some support with cleaning or all of these kinds of things. There's lots of different options. Okay. I'm going to take a second and talk about our Maker Ability Hub. So we have been working really hard over the last 4 or 5 months with a network of makers that are in maker spaces that or are part of 4-H groups or the first robotics teams, and a few who are part of engineering departments at colleges. And then also we crossed the border into Vermont and have connected with the American Precision Museum. And all of those people already had 3D printers. And so we have created a partnership where if there is a solution that is needed, and I'll give you some examples in a moment, then a request can be made for a tool that is 3D printed that helps to solve that need and make that task easier. And then one of the makers will 3D print that and it can get shipped to the person who needs that at no cost. So ATinNH is part of that, is that we are supporting them by purchasing the materials that they need. They're also making a significant number of switch adapted toys that are going to be available to go out to families at no cost around Christmas time. So there's a couple of 4-H groups who are really involved and invested in that, and they are 3D printing and assembling the switches, and then they're going to adapt the toys that we have. And I'm working on a process for adapting a whole bunch of Nerf guns, which I think will be really fun. So they will be able to be switch adapted. And again, that's something that will get to the end user at no cost, which is pretty exciting. And all of those makers are volunteering their time to do this for us. And it's really fun to watch the teenagers get really excited about it and be really involved with it. They're also starting, some of the robotics kids are starting a project where they are working on adapted video gaming. So that might look like adapted handheld gaming switches or different types of joysticks that can be used with video games. And we also do have some of the mouth sip and puffs and the click kinds of controls. And so we're working on getting some of that stuff. And then with one of our partners hosting some in-person adapted video game events. And the hope is that then people will want to request some of those adapted controllers that they could then have at home. And that is another way to reduce that social isolation, because people can connect and chat with people through some of those video games, as long as there's someone to help make sure that that is all safe. So some of the things that will be 3D printing have a lot to do with supporting when people have fine motor controls or rigidity or different things like that. So We have all kinds of different things from styluses, knife holders, adapted pen holders, these adapted key holders, which are really helpful for people who have fine motor challenges, some bottle openers, like soda can openers. And this is just sort of a small example. We've got about 30 different items that we're going to be 3D printing that people will be able to request from us. And the plan is for that to be up and rolling by the end of October. They are all 3D printing things right now, but I don't want to take requests until I have them in my hands. Just sort of a general review of what is assistive technology. It's really any device, software, or tool that helps a person with a disability navigate the world more independently. It can range from high-tech solutions to simple adaptive tools. There's, we have a whole bunch of different tools. And the big thing is to remember that assistive technology is not about giving people an advantage. It's about allowing people to have that equal access to opportunities and independence. And my personal philosophy is about reducing the amount of energy it takes to do tasks that you have to do and that you want to do, so that there can be more joy and energy to do all of those fun things. I think that is my personal hope for people when they engage with assistive technology, is that it is a way to remove a barrier and to remove frustration. And so it wasn't in the pictures, but some of the other things that we're working on 3D printing are things like zipper pulls that you can hook your fingers into, pull a zipper up, or buttoning supports, and little caps that seem so simple, but they go on the end of the toothpaste. And so if someone has a tendency to squeeze too much toothpaste out, it reduces that and makes it so that someone can be more independent and not need to be supervised or supported as much in doing things like brushing their teeth, which seems simple. But as you know, if you're a caregiver and you are helping with all of the different little things, it is a lot of energy on the caregiver. And so if we can provide some of those tools that will help make it easier for a person to do all of those activities independently, I think that is our main goal. So there's always the questions about who pays for assistive technology. School systems often pay for assistive technology that is connected to education. It's important to know that assistive technology in IDEA is also a service and can go into the service grid in terms of making sure that the student is trained, that the staff is trained, and that families are trained, and that those pieces of assistive technology, if they're connected to the student being able to do homework or communicate at home, then they need to also travel home. And so that's an important thing. There's also funding in Medicaid, there's Medicaid waivers. There's some funds in some of these different places. And if you've got case managers involved, they may be able to help navigate the funding of some assistive technology. Some private health insurances typically pay for more of the durable medical equipment, things like shower chairs, commodes, walkers, Hoyer lifts, all of those types of things. Also, voc rehab and other training programs will help fund assistive technology for work training. And one of the things that I think is important to talk about if you are supporting a child who's getting ready to transition out of school into either the workplace or college, is that There are forms that can be used around assistive technology and transition. And um, one of the things that is coming to the surface is that oftentimes students have access to Chromebooks in public schools, which is wonderful for them to access, and they often have added apps for reading and writing and supports, and those are fantastic while you're in school, but there are not very many workplaces or college programs that the Chromebook knowledge transfers to. Most of those places are either going to be using a PC with Microsoft Word and all of those tools, or in some cases Macs. And the skills and the understanding of how to use that basic computer stuff and how to navigate them is something that is important for kiddos to learn as they are getting ready to transition. And then employers also pay for assistive technology as a reasonable accommodation. And so there's a whole bunch. And then I put a link in here to a funding resources guide. And so our goal at ATinNH is to allow you to try out the different items that are available, and the ability to try things out and see what works for you before you purchase them is really important. And it can also help you to make sure that there is a way of documenting what was effective and communicating what worked and what didn't work. So just as a, you know, an example, there's, 10 different kinds of walkers. There's rollers with arms up high. There's ones that don't have a seat. There's ones that have seats. And so which one is the right one to request? Yeah, so I'm going to show you in a second our AT for All site, which is where you can search and borrow items. I just really want to make sure that I say, in order to borrow items, you need to create an account. You need to check your spam email because it sends an email to you, and 90% of the time it goes into spam, and we get an email saying, I tried to create an account, but I'm not getting the follow-up email. So make sure you check that spam. And then you have an account with a password, you log in, and you can shop. And then, it's shopping for loans. And then you check items out. And I'm going to show you that in a second. But first, I want to talk also about that we have a partnership with the discount purchasing program. And there is a booklet and that has percentage of discounts for hundreds of different assistive technology companies. Families can use it, case managers can use it, schools can use it, folk rehab counselors can use it, educators can use it. You just have to live in New Hampshire, and you can access that, and then you can email Amanda, who's the woman who runs the company that we have this relationship with. And you can say, I need to buy these things, and they may be from different companies, and she will put together one quote for you and one invoice for all of the different items. And that can help case managers and different people to be able to, and families to order things in an easier way. So you don't have to order things from a whole bunch of different places, and there's a discount built in. So that I'm gonna stop sharing, and then I'm gonna reshare so that I can show you my screen. So this is what, can you see this? I'm hoping.
Yes, we can see it.
Okay. So this is what our ATinNH, this is our database of where you can borrow things. I'm logged in as an admin, so you won't have this left side, but you you can click on these different areas and it will bring up a whole bunch of different things for each of those areas. But you can also search for something specific. And so I've got the word kit install, typed up here. And so what we did, we worked really hard this year to make it easy for people to borrow things that will help them make decisions. So for example, we have an adapted art kit and it has all of these different things in it. It has, if you click on it, it'll show you, it's going to be slow. It has a whole bunch of different tools that allow people with different needs based on their ability to grip and use art tools to try out and see what is going to work best for them to be able to paint or color, or do you need all, and a school could borrow this, a parent could borrow this, you can use it for a while, and then there's a handout in it that tells you where you can order those things. We also have things like this is an adapted handwriting kit. So if you have someone who's struggling with their grip and figuring out how to write in a way that works so people can read it, this has a ton of different adapted types of grips. There's weighted pens and pencils. There's there's so many different cool ways. These little ones, these ones your fingers go in. And so you can try them all out so that you don't go and buy a whole bunch of different kinds and then say, oh, well, none of those work, and they end up in a drawer and you wasted money. The Leggy Liner kit is this really neat stamping tool that allows you to, oh, I got to show you this because it's neat. It allows you to roll out lines onto paper. So you can make little square boxes that are bigger or smaller. You can make the lined paper. So if students or people are working on where they put their lines or where they write their letters or their numbers, if someone struggles with math worksheets because there aren't clear spaces where the rows of numbers should go in, there's little boxes and it's just a roller stamp. And so those are pretty neat and you can try those out. There's sensory kit. There's an adapted literacy and reading kit that has all kinds of different things in it. So that, and then if you want to search for something different, my big suggestion, and I'm not sure why this is a glitch and I'm not in control of this. This is a software that we pay for. If you hit this refresh button, because sometimes if you try to search for something different, it won't show up. But here's this is the list of all the different apps that we have. So you can check out an iPad and get some apps and try them out and see what might work for someone that you are working with. You can also, I'm going to go to all categories. I'm going to search for, there's also a lot of different types of switches to adapt things and to be able to control a computer in different ways. And there's ones that have different textures. Those are really helpful for people who are low vision. There's switches that you can be used as head switches, all kinds of different things. So, and you can, again, borrow any of those. There's one-handed keyboards. There's, a whole variety of things. Let me see. No, let me. So here is our adapted meal prep kit that I was talking about. This is a pretty big kit and it has a lot of items in it. So it has a variety of different types of knives that someone might try out. Suction cup bowl, an adapted cutting board, some different types and ways to measure things that are color coded, all kinds of different ways that you might peel vegetables. These are pretty neat. Your fingers go in them and you use it as a potato peel. It's much safer for people who have motor challenges. And there's just a lot of different tools that you can borrow. So, yeah, I'm going to stop sharing my screen and see if there's any questions. Any questions or any things that people want to know more about, or I should say that our new website it's in process of being revamped, is set to go live mid-October. And that, I mean, right now you can still access this, but our new website will have a whole lot of different resources, including some forms and some ways to advocate for things, and some really cool videos, and yeah, links to funding stuff and how to request those 3D printed items. So.
All right. So if anybody has any questions, you can drop it into the Q&A. Oh. Can Medicaid cover any cost when purchasing the adaptive equipment?
Oh, what did I just do? Are you there?
Yep, we can
Oh,
still
that
see
was
you.
weird. I clicked on
Yeah.
something. So, yes, Medicaid, and you would need to, work with your doctor, because insurances and Medicaid, you have to have a prescription, and so that can involve having a care provider write something up, or requesting that your doctor write that prescription based on a need. Um, and I will share that AI, some of the AI tools like ChatGPT or Copilot are not terrible at writing example requests that you could share with a medical provider. Not that they take the place of a professional. And if you are looking for a communication device to be paid for through Medicare or Medicaid, you need to do, there's rules about that, and you would need to do a trial and prove that it was going to be effective, but it happens often. Most insurances cover durable medical equipment. So those are things like a wheelchair, a walker, a Hoyer lift, those kinds of things. And then there's also Medicaid waivers, and those can cover things that are separate from those durable medical equipment things. And it's really about working with your doctor or case manager, and working on accessing those.
Thank you, Sarah.
Yeah.
Are there switch options for electric hospital beds?
Ooh, that's a good question. Um, I think that would be a pretty individualized, like you would need to be able to have the hospital beds controller to see if we could plug a switch into it. So a lot of the switches plug in through like a headphone type jack into the toy or into the item that they're going to control. Um, and so it could be possible. Um, but I have not done that.
All right.
Um, so yeah.
Will the PowerPoint information be available? I can answer that. Yes.
Yeah.
We are recording this session as well, so both the PowerPoint and the recording will be available on the CSNI.
Yeah, and that way you can access all the links that are in there too.
Right. Will BDS require that these funding requests be run through Medicaid for a denial before approving assistive technology funding?
So I think, again, that depends on what the assistive technology is, right? So the durable medical equipment, I think there's certain things that Medicaid or Medicare will cover. And then the waivers are related to other things. And so there's definitely, I can include at the end of the slideshow, I can add, there's a couple of videos that are on DHHS's website that talk about assistive technology and the waivers specifically, and go more into depth with that. So,
Do iPads have to be an Apple product?
well, iPads are an Apple product. So yes, we do have a few tablets that are not iPads. We do not have as many apps for the tablets though. We do have about 30 iPads in our inventory that you can request apps on. You cannot, just so I'm being really clear, because an iPad in and of itself is not assistive technology. If you request an iPad from us, you need to request apps. And because the goal is for you to be trying out some assistive technology on that to support someone with a disability.
Let me go over to the
And
chat.
those, just so you know, iPads can be borrowed. Everything in our lending library can be borrowed for 45 days. We ship them to you. And when it is time for them to be returned, we will email you a shipping label and you need to keep the box. And there's directions are all there. And then you would be responsible to ship it back to us.
I may have missed this, but did you talk about the length of time that a person can try out? Like how
Oh, yeah. 45 days is our standard time that you can borrow things. I will say, okay, so we have a number of partners. So for example, Derry Loaner Closet, Chapin Senior Center, Grafton County Senior Center are partners of ours, and they have a lot of the durable medical equipment. So they have things like walkers and wheelchairs, not power wheelchairs, but wheelchairs, shower chairs, commodes, canes, those kinds of things. And they often do what's called an open-ended loan. So you can keep it as long as you need it. And then we have some other devices, things like activity chairs. We have a really cool contraption that you would probably want to have an OT or a PT help set up, but it's a gait. We have gait trainers and pacing trainers for kids. And we have one that will allow you, there's an activity chair that allows you to be in laying down position so that if somebody needed support to be able to do table work but in a laying down position, that can happen. We have trip trap chairs and we have like these little tiny wheelchair scooters are like a bumbo thing that were like a toddler or little one could sit in and roll it. So we have a whole bunch of different things that if you need something a little bit longer, we can make exceptions. Because a lot of those kinds of things are not borrowed very often. And it could be that you're borrowing it to make a decision, or you're borrowing it while you're waiting to have insurance cover something or to be able to purchase something.
Do you have information on how to donate equipment to the refurbished equipment marketplace you mentioned?
Yes. You can. So they are in Concord. And they're open Monday through Thursday, and you can literally just walk in. And there's a couple of folks there. You can also walk in if you need something and just say, "Hey, I need this or that." Um, so let me see. I can give you their phone number. It's 603 226 2903. And they're there, like I said, Monday through Thursday. They are not open to the public on Fridays because that's when they're doing a lot of their taking things apart and fixing them. And one of the things that they have that's pretty cool is if you have like a wheelchair, a scooter, or toilet chair, shower chair that you want to donate and it feels kind of weird because it's dirty, it's okay. They have this really cool thing called a scrub hub that's like a car wash and sterilizer for wheelchairs. And so they have a process for really getting things deeply cleaned. And they do take power wheelchairs and scooters. One of our things that we do with them as a partnership is make sure that they always have batteries and things for those.
And is that located on Regional Drive?
Yes,
Okay.
sorry.
So
Yeah.
it's 57 Regional Drive in Concord. Great. And then there was a question in the chat.
Sorry, I want to add that sometimes if it's really difficult for someone to get to Concord to deliver things, we can arrange to pick things up from you too. I've done that before. I can borrow a van and do that once in a while. We just have to plan it.
Do you have any links for grants, mostly for additions for safety of being on the main floor of a house?
So in that slideshow, there is a link to the ATIA funding page, and they have a lot of that kind of information in there. And then there's also a couple of there's a few places that have very specific things. So REQ, which is they help people, like they'll fit you with and help you figure some of those things out, has a whole billing department that can sometimes help. And they're um in Manchester on Candia Road, and their phone number is 603-645-5200. But if you look them up on REQ in New Hampshire, and then the other place that's a little bit more specific, um, it's for spinal cord injuries, is Victoria's Victory Foundation. Um, and they're connected to Boston Walks, which is in Stratham, New Hampshire. But hold on, I can put this. I'm gonna actually put this link in the chat. How's that? And they have a resource person that can help folks get connected with some scholarships and things. But when our new website comes out, one of the things that we are building right now is a searchable statewide resource guide. So it will have, by county, what are the companies that do home modifications in my area? What are some funding resources? All of that kind of stuff. That part, because we are building it with we had contracted with an outside organization, is I think their timeline was to get it done was not until December, but it's coming. And we're pretty excited about that. It's been, a lot of work. We brought on an extra staff person to help us pull all those resources together, so that if you need to take adapted driver's ed, who does that in our state, and how do you connect with them? And there will be funding stuff on there. So
Then there's one last question. My son benefited greatly from Leapfrog and VTech toys as a child. This is how he learned to read and write. Would such learning toys be anything you would want to offer in the library, even to donate to kids who might benefit? Though they are considered obsolete, they really are AT.
So here's the tricky thing. So I think that there's probably okay, I'm going to answer this question in an interesting way. So we're trying really hard to have things in the lending library that people can purchase, right? Because the goal of the grant is to try before you buy, so you do not spend money on things that won't work for you. And so we've been working hard to pull out things that are obsolete. That being said, we do have some things in this lending library database that are available for free. Uh, I'm not sure if you guys can hear it. My dog is barking behind me. Sorry. um, um, and so we do take in donations of things like that, but then we would list in the lending library as available for free as a rehomed kind of an item.
Right. So that is the end of our questions. There was a request, if you don't mind, just resharing the slide that has your contact information. So I think it was the second slide. And we can leave that up for folks to take down your information. But other than that, I think we are at the end.
All right. I will do
Right.
that right now.
Great. Well, thank you so much, everybody. I really appreciate you all joining today. And thank you so much, Sarah, for your
Yeah.
presentation.
And yeah, just sorry. I'm sorry to interrupt, but we also do provide a technical assistance. So if you've got someone and you're like, these are the challenges, what do you recommend? You can send an email. And if I don't know the answer, we have a network of partners around the state. And then I also have access to everyone who has my same job across the whole country. And we have a space where if we have someone who has a question or a need and we're not sure, we can put it out there to all of the different assistive tech specialists across the country and get an answer around, oh, maybe they want to try this tool or that tool. So that's another resource. Okay. Sorry.
Well, thank you so much, everybody. I will leave this up for a couple minutes until 4 for folks to take down any information that they need. Again, we did record this, so we will be posting it to the CSNI website as well. So thank you so much, everybody.
Thank you
And
all for
have a
joining.
wonderful afternoon. Thank you, Sarah.
Yeah. Thank you.
Great.